Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and our today's topic of emergency medicine is cardiac dysrhythmias. The different topics which we will discuss or the outline of our today's lecture, what we will discuss. First, we will go over some anatomic essentials. Anatomic essentials are very important because when we talk about cardiac dysrhythmias, dysrhythmias are the abnormality in the rhythm of the heart. And that rhythm of the heart is very important for the normal functioning of the heart, to pump the blood out of the heart, to create a normal cardiac cycle. If that cycle is disturbed and the rhythm of the heart is not normal, that's labeled as dysrhythmias or arrhythmias. They are synonyms, they can be used with each other. So first, anatomic essentials that we will cover in our today's topic. Then we will go over the physical examination of the patient and how we examine the patient with the cardiac dysrhythmias. In this, we will go over the general appearance of the patient and then some systemic examination of the patient. History is very important also as a part of examination. So history, then the general appearance of the patient, and then we will go over the systemic examination of the patient. Then we will discuss the radiologic studies, what are the different findings on the X-ray of the chest in patients with the cardiac dysrhythmias. Then some lab studies which will be like a cardiac enzymes, electrolyte studies, and we will go over that also. Specific bradydysrhythmias. Dysrhythmias, as I mentioned, is the abnormal rhythm of the heart or abnormality in the rhythm of the heart. But if they are bradydysrhythmia, brady means slow. So when the heart is slow or the pulse rate is low, that's the bradydysrhythmias. So specifically, we will discuss those bradydysrhythmias. Same, we will talk about tachydysrhythmias, or the when the heart rate is high or the pulse is fast, that's the tachydysrhythmias. They are the arrhythmias or dysrhythmias, but they are fast dysrhythmias. So all these topics will be discussed in our today's lecture of cardiac dysrhythmias. And then we have also other slides available or other lectures relating to different subjects are available on our website, so you can also watch those lectures besides the emergency medicine lectures. Thanks for watching sqadia.com.